Good morning, sir.
How are you?
I'm fine, and you?
Mambo mazuri.
I'm good.
Safi kabisa.
Yeah.
Right. We are headed in a festive season.
Yeah, very true.
How do you feel now?
Kinda off.
Do you have offs and leaves
Yeah.
in your field?
Yeah, we do.
Mm-hmm.
Yeah, we do have offs and leaves, but at the moment, we can't all go because we are among the essential service providers. Yeah, right. So we can't all go just like that. Mm-hmm. Yeah, so the arrangement that some are going and some will be remaining to.
Okay, yeah. That's good. We are also part of the essential service providers. I'll be here all through. Yeah, otherwise, you're grateful for coming and welcome to the show this morning. Yeah. If somebody is watching you for the very first time, Bwana Hassan Abdallah Nani?
Okay. Abdallah Hassan, that's my name. Mm-hmm. Yeah. I'm in my late 20s.
Late 20s?
Yeah.
Right.
Yeah, late 20s, happily married. Yeah. Professionally.
You had to put happily?
Yeah.
Okay.
Happily. Yeah. Okay. My profession, I'm a public health officer, and I'm based in Mombasa County, Changamwe Sub-County, Port Reitz Ward.
Right.
Yeah.
Very true. Okay. Ladies and gentlemen, like you have heard him mention, he's a public health officer within Changamwe and Jomvu, and he has been talking about matters to do with the health, and he's here particularly to mention about this topic, that is healthcare waste management. What do we mean when we're talking about that?
Okay. First of all, I think it will be very nice to start by defining the word healthcare. Mm-hmm. Healthcare. The healthcare, when we're talking about healthcare waste, first of all, people need to understand what's healthcare waste. Yeah, because we have different types of waste. We have municipal waste, mm-hmm. and we have healthcare waste.
Okay.
So when we're talking about healthcare waste, these are wastes that are generated from healthcare settings. Mm-hmm. Yeah. And when we talk about healthcare settings, I mean we have from the level 2 facilities to the level 5 facilities. Yeah, those are dispensaries to the national referral hospitals, research centers, and laboratories.
Right.
Yeah. These are the wastes that come from the services provided in such institutions. Mm-hmm. Yeah.
Right. So does not mean that it's the normal waste that we see around here, makaratasi here and there.
Okay, in a hospital settings, we have different departments. So most likely you'll find the newspapers. Mm-hmm. We have newspapers, we have packagings, we have banana peels.
Right.
Yeah. Those are the same ones that I know here in Most TV, they might be here as well. Right. Yeah. So in hospital settings, we have different types of waste generated, and there is a way that we can identify such waste, mm-hmm. yeah, on how they're generated, and the management of such waste also is different. Mm-hmm. Yeah, because in a hospital setting, we have waste that we categorize it as a general waste. Yeah, this is waste that is not hazardous. Mm-hmm. Yeah. Then we have waste that is infectious waste. Then there is waste that we refer to it as highly infectious waste. Mm-hmm. Yeah. So when I talk about general waste, I talk about waste that doesn't have any pathogens in it. Mm-hmm. Yeah. Waste that can't transmit any disease to anyone. Once maybe a healthcare staff or cleaners or visitors in the hospital setting gets into contact with such waste. Mm-hmm. Yeah. And examples of such waste is, as I had said earlier, we have newspapers, we have banana peels, we have kitchen refuse, because in a hospital settings,
there must be a kitchen as well.
There must be a kitchen as well. Yeah. So we can categorize such waste as general waste.
Right.
And in a healthcare settings, around 75% of the waste that is being generated is general waste. The waste that we can refer to it as infectious or highly infectious waste, mm-hmm. is around 25%. So much of the waste that is being generated in a hospital setting is general waste. And on the other hand, the 25% that is remaining is the infectious or highly infectious waste, of which that's the major. Like when we're in hospital settings, that's like it's our core mandate to ensure that this 25% of the waste that is generated in the hospital setting is properly stored and is properly disposed of.
True. Now, before we get to the 20% of the other waste, looking at this general waste here, do you feel it's also, there's a need of us taking so serious the general waste in itself, even though it doesn't cause any sort of infections?
Yeah, there is need we take care of this general waste, yeah? Because when I talk about general waste, it's a mixture, yeah. We have paper, we can have pieces of timber, we can have plastics, yeah. And as you know, we have regulatory bodies like NEMA, they ban plastics, yeah. It's because once these plastics end up being banned, they don't, there are certain temperatures that the open burning doesn't reach, so there are chemicals. They are referred as POPs.
Right.
Yeah, persistent organic pollutants. They tend to stay for a very long time in the atmosphere, and they can cause there are diseases that can be caused by such pollutants.
Right.
Yeah. So when we talk about general waste, we still have plastics, of which plastic is a major concern. Even in the municipal waste, yeah, the Department of Environment and the Department of Health, yeah, we have issues when it comes to banning of plastics. Yeah, so general waste, there is a part, there are parts of plastic that are found in general waste.
Right.
So I can say that when we're handling general waste, yeah, we have a problem, though it's not something that just happen immediately, but it's something that can cause our health.
Right.
Yeah, long term.
Right. It's long term.
Yeah.
It's not that short term thing.
Yeah.
And if somebody maybe is tuning in for the first time and is wondering, healthcare waste management, is it important? Let's begin from that point of view.
Yeah. Okay. Thank you for your question. Yeah. Healthcare, okay, first of all, when we're talking about healthcare service provision, as public health, we have the preventive component, of which is our core mandate. Yeah, the preventive component.
Right.
Then we have the curative component. Yeah. So when we're talking about the curative component, we just find that all this waste come from the what? From the curative component.
Right.
And for us to say that you are getting quality services, it means that you get into the hospital, you are treated. After being treated, once you go back to your home, the waste that has been generated, there is no way that it can cause diseases to, let's say, the cleaners or to the maybe it can harm the environment or the community around. Yeah. So when you're talking about quality healthcare, healthcare waste management is part of it.
Right.
So once you're giving like services like curative services, but you're not doing like you don't manage your healthcare waste well, we can just say like you're not giving quality services. Because on one side you are curing people, but on the other side you're predisposing people to other diseases. Yeah. So you're talking about quality health services, healthcare waste management is core.
Yeah. Right, very true. Yeah. Ladies and gentlemen, now I think you've understood what we are discussing this morning here. That is healthcare waste management. Quite a component when we are talking about quality healthcare services. A good explanation from my guest, that is Abdallah Hassan, who is a public health officer within Mombasa here. And we will have to talk a lot more, but before we even get too far, we'd like to remind you that you've got an option to talk to us as well. How do you feel about the health waste management? Do you think they are doing much in terms of healthcare waste management? What are some of the roles that you think you can play as well in assisting them in making sure that we dispose some of these items they use very well. As well, the numbers below your screen. Move to all our social media platforms, and I believe we are up and running on Facebook as well. There is that comment section. You can share your comment and any question to my guests, and we will be much willing to answer them as we get along with this show. And I heard you mention about, healthcare personnel having to, expose themselves, even though they provide the service. And to some extent, if these things are not controlled and not managed properly, they may get to, infect themselves. And the question is here, you are the frontliners in all these aspects about health. How, at what risk are you guys in when you're talking about poor waste management, particularly from the healthcare sector?
Okay, from the healthcare sector, yeah, there are people that are at risk, as you've said. First of all, we have the people that are giving services directly to the clients. These people are at risk. Yeah. The other people that are at risk are the people that they do, they clean. Yeah. After the procedures, there are people that come and do the cleaning. They come and do the disinfection, something of that sort. Yeah. Another people that are at risk, there are people that we refer as waste handlers.
Right.
Yeah. They take the waste from one point to another point. These are another people that are at risk. The other people that are at risk are visitors. Yeah. So when I talk about visitors, I'm talking about the general public. Because I know you just don't come to a health facility unless maybe you are sick or you are there to support maybe your beloved one, something of that sort. Yeah. So these are the people that are at risk. Yeah. And healthcare waste management, I can say it's a system. It's a system of which for a system to work, different people need to play different roles.
True.
Yeah. And different mechanisms are supposed to be in place for that system to work. Yeah. So for healthcare waste management, first of all, the waste, since we are giving services, waste is guaranteed. Yeah. But there are commodities that need to be in place. There are personnel that need to be in place. There is the training component that still needs to be in place, and we need to have.
Do you mean there is training for waste management?
Yeah, very true. There is training.
Right.
Yeah, there is training, and we need to have technologies for disposing of the waste.
Right.
Yeah. So I can say the doctors. The doctor might be at risk, and the cleaner might be at risk.
Right.
And the visitor that comes at the facility might be at risk as well. So we need to have a system that each and everyone takes responsibility, knows his roles, and I think everything moves smoothly.
Everything moves smoothly.
Yeah.
But listening to you really, I see a scenario. I see from there I've understood to some extent. Basically, the much role that needs to be played here in healthcare waste management solidly comes from your side.
Yeah.
And we, the people who come into the health service, through the healthcare institutions to get the services, have minimal roles to play. Is that right?
Yeah, that's true.
And if Wananchi now is listening and he wonders, do I have even a role to play in helping you guys in waste disposal?
Yeah, Wananchi or the general public, they have a role that they are supposed to play.
Right.
To ensure that first of all their own safety. Another thing, the safety of maybe the cleaner, something of that sort.
Right.
Yeah. I can give you an example. Let's say, Mr. Shadrach, let's say you visited Chani dispensary, for instance. You have your face mask. We don't know whether maybe you're suffering, maybe you have influenza, maybe you have any contagious disease. Yeah. Then you just come at Chani and just you dispose of your mask anyhow.
Okay.
So you're expecting somebody else to come pick that mask and put it where it's supposed to be. Yeah. So once that person comes and handle that mask recklessly,
Right.
yeah, or in a manner that is not supposed to be handled, Mr. Shadrach, you are predisposing that cleaner to, let's say, influenza.
Right.
So when I'm talking about Shadrach, I'm talking about the public. Yeah.
Right.
So any member of the public, once you come at a healthcare setting, there are things that, okay, you know, maybe awareness, when that's where the gap is, awareness. You
And
might find
ignorance
somebody,
from the side of the
okay, yeah,
public,
I can
right.
say, lack of awareness. Yeah. But in our hospital settings, we try have like well-labeled instructions of how different wastes are supposed to be
Dumped.
to be dumped.
True.
Yeah.
Right. I want to take a short break here. When I come back, you know, we have this quite a challenge when it comes to how we dispose of our waste and our waste management mechanisms. We do not have the necessary technology so far. It's quite a challenge within Mombasa County. And I want to understand now from your side, you as healthcare services providers, how are things like? You've mentioned about technology, you've mentioned about this mechanism that you guys are supposed to be using. Are they there in our facilities? How far have you gotten with healthcare waste management? You'll be coming to explain that as we get back to the show. Ladies and gentlemen, allow us to take a short break here. When we come back, we'll be digging deeper. Remember, we've just gotten started. This is our first break that we're taking here. When we come back, we'll be looking at how far are we in our waste management, particularly within the healthcare service providers, and what needs to be done going forward. Don't go too far. We'll be coming back in a moment. When we are talking about, earlier on you were telling me about general waste, and we now know some of the few general waste, and we've given examples. Some of them are also found here in studio. But when we come furthermore, now you were telling me there are categories of this kind of waste. You can shed more light concerning that as well.
Okay, thank you. Okay, as I think in the first session I exhausted on general waste. Yeah, but we also have another category of which is referred as infectious waste. Yeah, infectious waste is waste that contain pathogens. Yeah, these are disease-causing agents. They can be bacteria, they can be viruses, they can be parasites, they can be fungi.
Right.
Yeah. So, in a healthcare setting, there are procedures that might cause let's say we have let me give examples, then I'll expound so that
Go ahead.
the audience can understand better. Okay, like highly infectious waste. These are wastes that are in contact with bodily fluids. Yeah, let's say vomiters. Let's say blood. Yeah, because blood, there is a high possibility of blood having bacteria, viruses.
Right.
Yeah, something of that sort. So once I'm using, let's say, the latex gloves during a procedure, and I get into contact with blood, the glove, I consider it as infectious waste because it has a bodily fluid. Yeah. Let's say I'm doing a procedure and let's say my client vomits. That's a bodily fluid. The material that has got into contact with the vomit, I consider it as infectious waste. Let's say a client is diarrheaing, the fecal matter.
Right.
Let's say the diapers that are being used in some patients use diapers. Yeah. So the fecal matter that gets into contact with that diaper, I consider it as infectious waste. Yeah. Okay. And for highly infectious waste, we can highly infectious waste, like it's a subcategory of infectious waste. But in this context, the highly infectious waste mostly we refer to as pathological waste or anatomical waste. These are body organs, body tissues that are due to medical procedures. Let's, for instance, you have a problem with a tooth. Yeah. Once the doctor goes and takes out the tooth, we consider that tooth as highly infectious. Yeah. For instance, you are amputated the leg or a finger, we just consider that as highly infectious. Yeah. For women, once they give birth, we have the umbilical cord that is being cut. We consider that as highly infectious waste.
Right.
Yeah. And in healthcare settings, I think I had talked about issues of mechanisms that are in place. Yeah, in healthcare settings, we have an aspect of waste segregation, yeah, of which when I talk about waste segregation is where each waste is supposed to be.
Right.
Yeah. And that guides on the mode of disposal too. Yeah. So in a healthcare setting, once you come in, Mr. Shadrach, you'll see a yellow bin, you'll see a black bin,
right,
and you'll see a red bin. Black, yellow, and red.
Wait, are they meant for us?
Okay, at times you just find yourself in a healthcare facility and you want to dispose of an item. So it's very important as a member of the public, you know where that item is supposed to be placed.
Okay.
Yeah, so it's very important. And it's a key role that the members of the public need to understand. Once they visit the healthcare settings, they know, okay, I'm supposed to dispose this.
Right.
Okay, yeah, and for us as a healthcare providers or as public health professionals, our main work in a healthcare facility is to ensure that clear information is given to the public.
Right.
Clear information gets to the service providers, let's say the nurses, the clinicians, the medical doctors.
Right.
Yeah, they get the right information so that they also know that a certain type of waste goes to a certain type of bin.
Right.
Yeah. So the black bin is for general waste.
The normal ones we know.
Yeah, the black bin is for general waste.
That I can even dispose my mask if I want to dispose it.
For masks, as I gave you an example earlier, your mask, there is a high probability that you wear your mask, you will sneeze. Once you sneeze, there are fluids like a saliva,
Right.
yeah, that will get on that mask. So that mask, we consider it is as an infectious waste.
Okay.
So you can just take off your mask and put it in a black bin. Are we together?
Right.
Yeah. So for masks,
It has some bit of technical thing, you know, you must be keen.
yeah. So for masks, the mask, we consider them as infectious waste. So once you doff off your mask, you need to put it in a yellow bin, since it's an infectious waste. For papers, for packagings, for plastic bottles,
Black.
you can put it in a black because we consider them as general waste. Yeah. And the red bin, as I had said earlier, the red bin are for pathological waste. These are body organs and body tissues. Let's say you amputated, that body organ that has been amputated is supposed to be put in the red bin.
Do you want to tell me the red bin is all over the facility or what?
Yeah, okay, the red bin is supposed to be in departments, yeah, that are more likely to produce pathological waste.
Okay.
Like for instance, once you go to like a facility that has a theater, there is a high probability that you'll find a red bin there.
Right.
You go to, let's say, labor ward, you'll find a red bin.
Right.
Yeah. So those are the colors, and we also have other colors. Once you go to like hospitals, like county referrals or national, referral hospitals, you'll find a yellow. There is a yellow bin.
Right.
Yeah. Those are the yellow bins are used for healthcare settings that deal with cancer patients. Yeah. We have a cytotoxic waste. Yeah. Cytotoxic waste may mostly come from the cancer treatment units. So you see a purple bin, all the waste that comes from the cancer treatment unit goes off in the purple bin.
Right.
Yeah.
And listening to you also carefully and how you've explained it, it tells me that each of this category of wastes have its own ways of handling.
Yeah.
That's why this one is being put here, this one has been put here. Is that the case?
Yeah.
And now, for instance, if we are, and we've understood that we should put this here, the black one is for the general waste, the yellow one is for the infectious
waste.
and the highly one is for the
red is for pathological
right.
waste.
So from that point, where do we head to with the bins now? Once we've disposed them inside the bins, what follows?
Okay, first of all, a bin is a healthcare waste commodity, and we have a bin liner. It's a polythene bag. So you come to a healthcare setting, you'll find a black bin with a black bin liner. You find a yellow bin with a yellow bin liner. You find a red bin with a red bin liner. Yeah. So the bin liner is always like is in the bin.
Right.
Yeah. So once you put in the waste, once the waste is 3/4 full, the cleaner or the healthcare waste handlers, they come pick the bin liner. They come pick the bin liner. Yeah. Then we have a temporary storage area where we store the waste, awaiting final disposal. Yeah.
Right.
That's how it's done. Yeah. And before I forget, there are a type of waste that I haven't talked of. Sharps waste.
Sharp waste.
Yeah. These are very, it's a waste that it has a lot of problems and it has a huge impact on health. Yeah.
Right.
Now, and its mode of disposal is always a bit, it has some challenges. You need to be very keen when handling such waste. Yeah. And before I continue, I'd like to shed light to the public. They know what sharp wastes are. Yeah. When I talk about sharp wastes, these are wastes like they're like needles.
Right.
We have scalpels. We have ampoules. Let's say we have what? Okay, like for the purpose of understanding, scalpels are those small like razor blades.
Right.
We have needles and syringes. You'll find them being put in a box. Yeah, that's all. That's where all the sharp waste are supposed to be put in place. You go to any facility, you'll just find that that box. Yeah, all the sharp waste are being put there, and there is a red fill line. This information we always give it to the service providers.
Right.
When you talk about service providers, these are nurses and doctors. We give them that information that the waste is not supposed to pass the fill line.
Right.
Yeah. And once it's at the fill line, you take that box and you store it temporarily, awaiting final disposal. Yeah. And for sharp waste, as I have said earlier, yeah, most needles, they have some blood, on them. Once you injected, there are some blood residue that they remain on the needle.
Right.
Yeah, in such case, and they predispose the cleaners. They can predispose the service provider, to bloodborne diseases. When I talk about bloodborne diseases, I talk about hepatitis. We have hepatitis B, we have hepatitis C, and we have HIV.
Right.
Which is it's like every now and then we talk about HIV.
True.
Yeah.
I've heard you mentioned about putting the sharp, wastes inside a box.
Yeah.
So you place them inside that box and take them to the bin, or
No.
it will just stay within the box.
Okay. You just we have those boxes are heavy duty boxes. They are made of they are cardboard that is heavy duty.
Right.
Like they are puncture proof. Yeah. So once you're done with the procedure, you just take that syringe or that needle, you put it in that box. Yeah. Once it's almost 3/4 full, you just take it to a place that you store as you await final disposal. Yeah.
Right.
So there is no mixing. Yeah, there is no mixing at all.
At all.
And as public health officers, we have officers that are attached in facilities. So every morning they go around, they try identify such gaps. Once you identify any gap, you just call the departmental head. You talk to him or her about that gap and how it can be addressed. Yeah. And time to time we also do like we have continuous medical education sessions,
right,
of which we call all the departmental heads addressing the issue of healthcare waste management. Because this is not something that you'll just be told once and it sticks. You know, yeah. At times there are pressure. You might do a certain procedure,
right,
then due to like you in haste, you take a syringe, you just put it in a black bin,
right.
Yeah, something of that sort. Yeah, so it's something that it needs a lot of refresher training, and sometimes we also do on-job training. Yeah,
right, true. And also, we want to discuss a little bit concerning where we are at as a county, and also at the areas of operations at Njomvu and Changamwe. How do you feel we are handling these matters about healthcare waste management? Are we good? Do you feel we kind of headed somewhere?
Okay, there are challenges, but you know, challenges can always be, we can overcome challenges. Yeah, they're not problems, they're challenges. So it means that we can have a way out of those challenges. Yeah, so I can say, yeah, like for Changamwe, you know, the technologies that have been placed,
right,
yeah, they are not working as per the, you know, there is a lot of growth, the facilities are growing, the population is growing. Yeah. And maybe, let's say, for instance, I can give an example of a technology. Let's say an incinerator. Yeah, let's say an incinerator that was built maybe back in 2007, 2005. Yeah, as we're speaking, in 2021, those are dozens of years that have passed. Yeah, so you might find such technology not serving the current situation well. Yeah. So in public health facilities, we have challenges when it comes to the technology. Yeah, we have challenges when it comes to the technology, especially when it comes to handling of or disposing of the sharp waste.
Right.
Yeah. And for private facilities or the medical clinics, they also have a huge challenge, because most of them, they don't have these technologies and they are dependent on the public facilities. So you just, there is that burden of which the public facilities already have, and the private facility also depend on the public facilities. Yeah, but for now, as a county or as a country, yeah, I think very soon we'll be overcoming such small challenges, because we have technologies, we have investments that are in place, and we're optimistic that they will address these challenges.
Right.
Yeah. For now, we're embracing, there is a technology that is known as non-burn technology. Yeah. The non-burn technology is a technology that the waste is being handled in such a way that there is no burning involved.
Right.
No burning involved. Yeah. I gave you an example of an incinerator. These incinerators, you might find there are certain temperatures that are supposed to be to let's say an incinerator. There are certain temperatures that are supposed to reach for that waste to be handled in a for the technology to be effective.
Right.
Yeah. So you might find some incinerators have problems. They don't reach such temperatures, and once they don't reach such temperatures, we have emissions. Like I've told you about some plastics and some
Exactly.
chemicals that are being emitted. Yeah, some fumes that are being emitted. So these are problems that in a long term, you might find problems of which the causes might be traced back to like 20, 25 years back.
Right.
Yeah.
Right. Hold that thought here. When we come back, we now take another short break here. When we come back, we'll be talking about more concerning now the way forward in terms of the government approaches in trying to, bring on board the technologies that you're mentioning here. Because from whatever I listen to you, it seems to me it's quite, it needs a lot in terms of finances and in terms of investment in line with the healthcare waste management. Ladies and gentlemen, that is what we are discussing this morning here together with my guest, Abdallah Hassan. And he's telling me that even though there has been a lot to celebrate in terms of healthcare management, particularly within Changamwe, Njomvu, and Mombasa County at large, still there are a few challenges that they are facing, and they're trying to be working harder to be optimistic as well in trying to solve some of those challenges that they are facing. And we'll be coming back to finish on that and also talk a little bit concerning COVID-19 with the rising number of new cases and what we need to do, the prevention measures. It seems to me that most people have forgotten all these, prevention measures. But of course, the biggest question people are asking out there, we are taking up vaccines and the numbers are increasing. How do that even resonate well? And the matrix between the vaccine intake and the new cases that we are recording, it's a festive season, what needs to be done? That is what we'll be coming also to look into here together with my guests. Kindly stay put. We are not going too far, and also you do not go too far. And we are now trying to sum it up on this first topic, that is the healthcare waste management, and we'll look at the COVID-19 situation and what we need to do, especially during this festive season. Coming back to you, Bwana Hassan, karibu sana. If we are to finish about health care waste management, what can you advise?
Okay. First of all, I'd like to pass this information to the private medical clinics around. Yeah. It's very, very important, and it's very key. Once they give their services, they also put healthcare waste in consideration. Yeah, not just giving services. Yeah, that's one.
Do you want to tell me they're notorious on this?
No, they're not notorious. But as I've said, there are challenges. Yeah, there are challenges because on their side, they're depending on the public. Yeah. And for us, the public, we have small challenges when it comes to the technology. Yeah. But for their case, we also have private companies that they handle waste.
Right.
So maybe if someone comes to the health, to the public health facilities and find that they can't get such services, instead of doing things that are not right, maybe they can go to the private
facilities.
The contracted company that can do that job for them. Yeah. Another thing, I'd like to pass this information to fellow health professionals. The issue of healthcare waste is very important, and once we go wrong, we predispose ourselves, our families, our colleagues, and the environment to harm.
Right.
Yeah. The last thing, maybe I can talk about healthcare waste. We were talking about technologies. For now, as Mombasa County, as I had said, we are embracing an unbanned technology. We have a microwave and shredder machine at Port Reitz Sub-County Hospital. And I think we are underway.
How does it
Once we are
operate?
fully operational, most of these small challenges that we are facing as public and most of the private facilities
Right.
will have been sorted. Yeah. You
It's
asked me
only
something.
in portraits.
Okay, for now it's in Portuguese. It was meant to, yeah, it's a big machine and it handles lots of waste.
Okay.
Yeah. So we'll be expecting waste from other facilities. Yeah.
Okay.
At a subsidized, so we'll be charging but a subsidized rate.
Right.
Yeah, something of that sort.
Good.
Yeah.
And of course, we must say that we will check on that as well. We'll follow up and make sure also we look at how things are at and some of these challenges, even though we've discussed them here, we want to see them being acted upon. And of course, it goes hand in hand in yielding fruits and positive results out from making sure that we have the health services that are being provided quality enough, with also matters about waste management in itself. Now, shifting gears to matter about COVID-19, and in the recent number of days, we've seen quite a huge number of persons getting COVID-19. The new cases are quite at the peak. Reason being?
Okay, maybe I can, in healthcare, at times we infer. Due to festive seasons and, most Kenyans relaxed on the preventive measures once the curfew was lifted. Yeah. So, yes, most of the members of the public, they just they are not like they are not into the preventive measures that were in place. Yeah. And another thing, this is a festive season. People are traveling from one corner of the country to other corner. Yeah. So that might be the reason as well.
Right.
Yeah.
And most people are even asking, like I had asked you before we took a break here.
Yeah.
We are taking up the COVID-19 vaccination.
Yeah.
And the numbers continue to increase.
Yeah.
What is the essence of it now?
Okay. For vaccines, the way vaccines work. For COVID-19, yes, you'll get the jab, but it doesn't stop you from contracting the disease. So you need to take the jab, and you need to observe all the preventive measures that are set for you to not to contract COVID-19.
Including putting on a face mask?
Yeah, very, very key. Very key. The vaccine.
We were told when we were told that if you take the COVID-19 vaccination jab, you can go around with your normal life,
Okay, that's not true. That's not true. Because once you get the jab, the only thing that jab will do to you once you get infected, the infection won't be that severe.
Right.
It will be mild. Yeah. Since your body will have produced antibodies already, the body has a memory of the virus.
Right.
It will fight off the virus as well, unlike you not having vaccinated.
Okay.
Yeah. But the issue of once you get the jab, like for me, I got my first and my second jab, but I ensure that I put on my mask wherever I go. I avoid crowded places. I wash my hands frequently. Yeah. So, and when the public, they say like we are, when you're talking about we are, and we have numbers, those are two different things.
Right.
Yeah, we are vaccinated, but we have numbers of people that are vaccinated. Yeah. Like for Mombasa, it's like 13.8% of the people that have been vaccinated. So when the public say we are, who are they?
Who are they? Who are they? True. So, in a nutshell, you're saying we should stick to adherence of the protocols.
Yeah, very important, especially in this festive season. We really need to up our game on the preventive measures. Yeah, it's your responsibility. It's not the government's responsibility. Yeah, don't let the police come and tell you like the people that they see the police, they put on the mask. Once they get off like the traffic they put off their mask. So I'd like to tell the people of Mombasa,
Right.
we need to take individual responsibility when it comes to prevention of COVID-19. Yeah.
Right.
And for those that haven't got their vaccines, we have Chani, we have Potri Sub-County Hospital, we have Bomu. They can go take the vaccine as well.
Right.
Yeah.
True. Do you foresee the numbers getting even more and more high during as we closer to January?
Okay, there is a possibility. Yeah, there is a possibility because the frequency of which people are traveling, like in this festive season, is high. Yeah. And there are places like, let's say, Nairobi. You might find the cases in Nairobi are high.
Right.
Yeah. So, and for now, it's like we're not doing mass testing. So maybe somebody somewhere, or even here in Boss TV, might be positive. Yeah. It's only that he has not been tested.
Right.
Yeah. Or maybe the virus, he has contracted the virus, but the way the virus is acting on his or her body, it's acting in a mild form. Yeah. So there is need that we take the preventive measures. Yeah. Let's put on our face masks.
Right.
Let's avoid if you don't have anything to do in crowded places, avoid such places. Yeah. And if you are in an enclosed space like this, ensure that it's well ventilated. Yeah. Go take your jab. Wash your hands frequently with running water and soap. I think that's the golden bullet that we have.
That's on the golden bullet.
Yeah, that we have. Yeah.
Are you sure that bullet's gonna kill Omicron?
Okay, for Omicron, I can't talk much on Omicron because it's something that has developed. And, there are still studies that are being done concerning the variant. Yeah, but viruses have a tendency of mutating.
Right.
So that's something that maybe the WHO or the healthcare fraternity had anticipated.
Right.
Yeah, because viruses keep on
Mutating.
on mutating.
Right. Otherwise, we are so grateful for your time.
Yeah.
Unfortunately, we can't go beyond there, but we do appreciate your time, and we do believe whatever we've spoken here and whatever you've said makes a bit of sense, and that will help somebody out there to understand all these matters about health. Right. And of course, we wish you all the best in the line of duty. Continue doing what you do best, and we'll be here to support you guys.
Thank you, thank you.
Thank you as well. Now, ladies and gentlemen, that has been Mr. Abdallah Hassan, a public health officer. As you can see, is quite dressed in, how do you call it?
Sun reflector. Yeah.
Right. You know,
We can say
it's your identity.
It's our emblem. Yeah. This is my identity.
Right.
Yeah. Once I do my field work,
Do we have quacks like you, Ukonji?
No.
I've had cases where people go around schools picking some few cash,
Not really, because if you go to a school, first of all, you need to identify yourself. Yeah, I can't just come here at Boss TV and tell you like, okay, where's what. First of all, yeah, it's as a code of conduct. Once I come to Boss TV, my name is so and so. I'm from such and such organization, and the purpose of my visit is very clear.
In chemist, I've seen there is a certain code that you can dial with your phone and see if this chemist is registered. Do we have another one like that for public health officers?
Not at the moment. Not at the moment.
Okay.
Yeah, not at the moment.
Right.
Because for us, I don't. No, not at the moment.
Right.
Yeah, we don't have such a mechanism.
Of course. But I do know with the few that have mingled, there are people with straight minds, and that they do the stuff well.
Yeah, we are young, we're innovative. Yeah, maybe we can come up with something of that sort.
Right.
Yeah.
Very true.
Yeah.
Otherwise, ladies and gentlemen, we've come to the end of our show today. Remember, every Wednesday it's all about matters to do with the health. We normally take time and find an unhealthy topic, so as we can sensitize, talk about it more, find professionals who understand this, and they are here and they'll be coming to help you understand more on all the issues around the health status in the country, in what have you. But in a nutshell, what we are saying, that COVID-19 is still with us, and we are, they're talking about the 5th wave here, and the numbers are increasing. So it's upon you to make sure that you take good care of yourself and help the government as well in combating the spread of COVID-19. By so doing, make sure you follow all the protocols set aside by the Ministry of Health. Until tomorrow, same time, same place, have yourself a nice day. Enjoy the rest of your viewing. And on behalf of everyone who made this program a success, coming to you live from the people on our gallery point there, we'd like to say thank you. Those who helped us out in this setting, we'd like to say thank you as well. Let's do this again tomorrow. Goodbye. Have yourself a nice day.